Okay. So welcome you guys back to another opportunity to learn and grow. My name is Sade with the Mahogany Project, better known as the Barefoot Therapist. And I'm coming to you with a fantastic guest who is the founder of the Women of Color Alliance, and she is a psychiatric nurse. She is a service member. She does a lot in and for the community. And she has a wealth of knowledge that I think would not only service our community, but really support like answering maybe some of the questions that you've had, especially as it is related to psychiatric care and mental health. So we have Miss Shatara Mackey with us today.
Yay. How are you?
I am great. I'm so glad to have this opportunity to interview you. And I like to say like how I met folks. So
Mm-hmm.
we met with Shatara reaching out and like giving me an opportunity to come speak to a group of women that she had. And it was such a beautiful connecting experience. And
Yes, it
again,
was.
out doing something for the community, which is how we met.
Mm-hmm. Absolutely. Thank you. I am so happy to be here. And definitely, it's very important that we continue to have these conversations so the population and at-risk populations be well informed to make well-informed decisions about their mental health and healthcare. So it's
Mm.
very important.
Well, can we start with telling us more about you, where you're from, how you got to Virginia, how you started your nonprofit?
Yes. I'm a Jersey girl. Jersey girl. I am in the military. I've been stationed in many places around the country. I've been in for the US Navy for 16 years. I was prior enlisted, and now I'm a nurse corps officer, and I work in the psychiatric floor in Portsmouth, Virginia. How I started Women of Color Mental Health Alliance was through my own struggles when I was going through a postpartum depression.
Mm.
And I was reaching out to, many people, and a lot of them were Black women who helped me overcome. And I said, hey, this is kind of this, we may be onto something. And sometimes I feel like women can help heal other women because we understand the struggles that we go through. So I wanted to create a support network of, for a safe place for women, especially women of color, to come to where they can talk about how they feel instead of, especially in a world where we're told that we have to be strong all the time and we have to act a certain way. I wanted to make sure they have a safe space to come to.
That's awesome. Well, and I'm so glad that you mentioned that even um especially postpartum. I don't think that that gets enough recognition for how
Mm-hmm.
detrimental that could be for women, because you have just went through this whole experience of bringing a life into the world, and you have this obligation that's now happening, but you also have this deep sense of sadness, and
Mm-hmm.
it can
Or
be.
not even a connection with your child. You're like, I have this child, and you think you feel like a bad mom. It's just, it goes through so many emotions. So, um, and what's crazy is about that is that I didn't even recognize it in myself. I didn't know what it was called until my friend who helped me with with my daughter was like, you have the baby blues. And I'm like, what are you talking about? And she was like, it's a postpartum depression. And I swear I never heard of that term prior to getting pregnant.
Wow.
And she brought it to light for me and explained it to me. And I was like, wow, I have to get this out to other people as well. So yeah,
That's
it happens.
awesome. Well, and
Yeah.
the thing is it happens more often than
Hmm.
I think people understand. I went through
Hmm.
postpartum for 2 years, and it was
Hmm.
a hard, like, as you know, it's
Hmm.
a hard and grueling, even just trying to get from moment to moment,
Hmm.
forget day to day.
Day for
Sometimes it's
moments.
just
Yeah.
getting through the moment of
Hmm.
like how feeling sad and feeling down, and I'm so glad that you were able to reach out to Black women to support you,
Hmm.
and that you
Hmm.
felt supported in doing that.
I definitely did. And I'm grateful for my friend. Her name is Chanel. I'm grateful for my friend for helping me through those times because me and her had our child months apart. So she
Mm.
was going through what she was going through, but she still, and we were able to still support each other. and definitely be able to talk about it with my provider and come up with some solutions, because a lot of times people don't recognize postpartum depression until you hear about something tragic happening to kids on the news or
Yeah.
something like that. But it's definitely more common in people of color, especially when we have especially when you have different especially urban areas and things like that. Is very definitely, we need to talk about that. We got to definitely talk about that.
Yes.
We got to do something about that. But yeah, it's definitely common.
Okay, yes. Well, and I wanna go a little further into that,
Hmm.
because so one of the things that I have to talk about a lot with
Hmm.
clients is when they're coming into outpatient and it
Hmm.
gets to a space where we're at a crossroads. And
Hmm.
I'm like, all right, we've tried just about everything that I know to try. And I think medication management is something to explore. Having to have that conversation is very challenging, because I think a lot of folks have already made a decision about how they feel about medication,
Hmm.
regardless of where the information came from. They've made a decision, and trying to support them. And at least, I don't even support, I'm not saying go out and just get medicated. You know,
Hmm.
you take whatever they give you. I'm even saying just go out and get assessed. Let
Hmm.
somebody else lay eyes on you who prescribes medication, who has that level of expertise, and let them tell you what they think is appropriate.
Hmm.
What is your experience in taking folks through that process and watching them struggle with even making the decision to get assessed?
So I work in inpatient. So um as I say, I deal with military service members, so we at this crossroads quite a bit, especially with Black and Latino, Hispanic population. So one thing that I realized that for me, and when it comes to assessing people that are lower ranking than me as junior sailors, I have to be real with them.
Yeah.
I have to really tell them, like, listen, I know historically, I know what happened. I know we were, because a lot of people link history with medication and experiments and things like that. But I had to tell them that I had a conversation with a couple of women, even with recently, and I said, hey, I'm on medication, and let
Mm,
me tell you what it does for me. And I say, I will always say, make sure you get and ask questions. If you don't understand, don't take something that you're not sure that you're taking. Ask questions. It's okay. You have the right. I let them know what their rights are,
yeah.
what they need to know. If the medication doesn't work, we just try something else.
Yeah.
I think a lot of times we when we think medication, I think it gets to the stigma, not only about the historic. I think it gets to the point where, well, like, you get stigmatized with being crazy, you get stigmatized with a whole bunch of stuff. And I tell them that there's no one else's business whether you take medication or not. But to be honest, we really have to be transparent about why they need to be assessed, and really say, listen, you got a lot going on, like you're doing. You got a lot going on, and I think you need to go see somebody to help. Nobody has to know. If you don't want to do it, that's up to you. But I want to make sure I'm giving you all the tools that I know I can give you.
Yeah.
You know, and it's hard because you want to be the best, therapist. You want to be make sure they get an informed decision. But as long as you give them all the tools, once you give them all the tools that they get, that person has to make that informed decision. And with the military is definitely a stigma with mental health. But I also realize that the leaders in higher positions have to be more transparent about what they're going through. I'm quick to say, like, hey, I'm on medication. I love Effexor to death. Ooh, I'm about to go. You took your medicine today. Let me go take mine. I have to do it on a level where they can understand me and see the human in me versus the nurse and the psychiatric nurse in me.
Yes.
Mhm.
And I love that you connect with them on a personal level, which is, I've worked in inpatient, and
Mhm.
and as you, I'm sure you know, that's not always the experience, which
Mhm.
is why I understand why people struggle with going to the doctor, because it's
Mhm.
like, okay, you get in there, they want to see you 5 minutes. All right,
Mhm.
you're struggling with what? List it. okay, here's the medication, and
Mm-hmm.
there's no attention to detail. There's no
Detail.
attention to why you're here. Could it be stress related?
Mm-hmm.
Could it be non-medically related?
Mm-hmm.
Tell me more about what the symptoms look like. But like you said, there's also no specific science to
Mm-hmm.
medication in that it requires trial and error.
Mm-hmm.
Can you talk more about that idea around trial and error and how people can better understand that it's okay? Like, it's not different from going to the doctor and saying, okay, well, I have diabetes. Okay, well, let's try this. How is that very similar? Because I
I
think people see it as different.
they definitely see it as different. And one thing about that the field that we're in, that is, because see, when you hear diabetes, you hear in your mind your process, okay, what type of diabetes I have? Okay, he said, you already know, nutrition management, insulin. It seemed like there's a fix, right? It's
Yeah.
like it's always like an end result. Okay, well, um, you know, and you might have cancer, so you may have to go through chemo. You could connect the dots, but see, with mental health, it's complex.
Yeah.
And what people have to understand is that I think mentally we have to try a different approach as doctors, and we have to say, like, how can we make them see that there's no different. This is no different than going to the doctor. We just have to talk to them like straight up. I just say, hey, listen, you'll go to the doctor to get this checked out, but you don't want to go get your mental health, which is the center part of your whole being. I feel like if your physical and your mental connects, and a lot of times they don't see the difference, especially when they don't see the individualized care. Like at our facility, they sit in front of a team of doctors, they get evaluated for like however long, and then they're in the unit, they're
Yeah.
they see the doctors and inpatient. So as nurses, it's really our job to make sure they understand. Even when we give the medication, I say, hey, you know what you're taking? They're like, no. I said, so why are you taking it?
Yeah.
Let me give you some education on what can really happen, what is this for, and things like that. But mental health is very complex, and it's the same but it's different
Yeah.
in the minds of the people.
Yeah.
And that's why I think education is very important when it comes to those things. Education is very important when it comes to that. Whew.
Well, let me go further on that.
Mm-hmm.
How would you, or what questions would you recommend people ask when they have a doctor that's recommending that they take medication? What questions do you think are most important to ask?
Okay, that is perfectly a great question. Whew, I have to tell people this. When a doctor is giving you medication, one, you have the right to know what side effects that it entails. How is it going to affect your day to day? Ask for a printout of that medication don't wait until you get to the pharmacy with a little printout, because nobody reads that. Ask the doctor right then there, hey, do you mind if I have a printout of the drug, what it does, and have them go over side effects. A lot of times, people gotta, even when you go to the regular doctor, they give you Motrin and Advil. You don't ask no questions because it's a common drug, but you should. You should ask what are the side effects and how is it going to affect me. Also, how long do I have to take it for? Can I stop it abruptly because about serotonin syndrome, all of those things. What is the longevity? What is the full care plan? Because medication is there to aid you. And I always like to think of medication as the point of helping with decision making process. And what I mean by that is that mental health obviously is 100% on that person. You are helping to aid them to get to from safety. I mean, from where they are to a safe place and a future treatment plan for them to, have mental wellness. But medication, to me, in my opinion, is more like helping with the decision making process, where it can, you're feeling something and you have a thought, and it's like, wait a minute, let me just take the time to it helps your brain transmitter say, hey, this is not a good decision. Gives you a chance to help you make better decisions, and that's just how I like to think of it. But you definitely have to ask questions. That's the problem. People don't be asking questions,
Yeah.
and then they take it, and then they like, oh, it doesn't work. Well, medication. I'm sorry, it doesn't work. It could take 6 to 8 weeks for that medication to work. You want things to work right away. So people, I don't know if it's us healthcare providers that need to educate more, or people definitely have to also take the responsibility to know what's best for them as well.
I love the way that you said that, and I absolutely agree.
Mm-hmm.
That is one of the things that we talk about is like, okay, you go into this appointment,
Yeah.
run down these questions. I don't want
Yes,
you to
right.
get in there and tell me, oh, and I start asking you what you take. Oh, I don't know, and I don't. That's not a reasonable answer for something you're investing, into your body, and you don't know what the outcomes are going to be. And I also love that you talked about it being an aid and not all of, that is exactly what I encourage people to consider it as. Like, if you are not even able to function enough to listen, have emotional stability enough to make decisions, you being able to be psychologically stable enough to be able to function day to day, then we need to consider medication. It will support you, but it doesn't make the decisions for you. It doesn't have to be a long-term situation for you. It can serve as a support, and that only. So I love the way that you explain that, because I think there's so many fears around medication.
Right. And it's very valid, very valid.
Yes.
Very valid.
I think it's valid, but I also have to say that now you have some folks that have genuinely had adverse experiences in using medication for psychiatric or psychological issues. But you've also had a lot of folks that just hear things or read things, and they don't have any validated information from a provider, from taking the medication from. So I really want people to have information outside of that to be able to make a reasonable decision.
Yes.
And if you decide not to, that's cool. I think that's the takeaway is, if you decide not to do that, that's cool, but there still needs to be a plan. Saying, okay, well, I'm not going to take the medication, but I'm not going to do anything else either. You're making a decision, and you need to be clear about what that decision is.
Got to be clear. And what we have to, that is very true. Mental health is definitely, and it's there are people with different disorders, with schizophrenia, bipolar, borderline personalities. Those are some very serious disorders that need medication management. And I think it's important also for the support systems that especially people of color, that, and nothing's wrong with church, nothing's wrong with this, and nothing wrong with that. But we have to really bring light that mental health is a real thing, and there are things out there to help them manage those symptoms. There's people that have these disorders that walk around every single day. You would never know, because they are on their medication management, they are going to their therapies, they are taking the time to do what's best for them. Also, and especially in urban communities, there's a lot of mental health issues in urban communities, but they don't have the providers or the access to care to get the information that they need to manage these different disorders. And I think that's what we're here for, and that's what we have to keep talking about. Big thing, like you said, it's okay if you don't want to take it, but it's okay if you do take it. It's okay. It is okay to take it. It's okay to seek mental health treatment. I think like us being like in this field, people of color seeing more of us being in here, being transparent about our issues. And I love the fact that, you go on TikTok, there's people talking about their mental health disorders, and showing like, hey, this is a life of me having a personality disorder, or this. I love that. I love that this technology is bringing much more awareness to people to do that for the younger generation. But the little bit more stubborn generation is the older generation, and they're the ones that they also went through a lot of traumatic experiences. So we just have to be honest and give them all the tools. I always say we give you all the tools you can to make a great informed decision for yourself.
Yes. Well, I want to ask you about that, because I know one of the other struggles is, why do I have to be diagnosed? Why do you have to label me? Why do you have to put a name to it? What is your perspective, or how do you explain the purpose or use of the labeling or the disorders?
Okay. That has many layers, and has many layers. I have been misdiagnosed before. with the label. I have met people that might misdiagnose and they feel labeled. So with it's a question that came to me the other day from a patient, like, why do I have to have this diagnosis and things like that? And what I like to tell them is, listen, in inpatient or outpatient, this is why a treatment plan is important, right? Especially in inpatient, we see, you can see people stay there, come back all the time. And when they come back all the time, you can kind of know who they are because they're coming back consistently. You already know they have this disorder. I tell them that when you're in inpatient treatment, we only see you for 3 to 5 days. And that's why it's and these psychologists are just, sometimes they just say, okay, this is the traits that we see, and this is what we feel like they may have, but you need to continue your outpatient treatment so you can get to where you got to go. The biggest thing is that I say, I understand that you're concerned about the diagnosis. Right now, I need you to focus on getting well.
Yeah.
Right? Focus on getting well. Your continued treatment with your psychologist or psychiatrist, they will get to know you a whole lot better than being in an inpatient unit for 2 to 7 days, because we're here just to make sure you're safe. Yeah. And whatever you come in with and what they feel like, hey, you might have cluster B traits, you might have some antisocial disorder because you said you wanted to kill everybody in downtown Norfolk somewhere. So you might have these traits, but labeling, I think sometimes I see more people being more receptive to knowing that if they know something is wrong with them. Yeah. Some people feel good with that. Wow, thank you. Oh my God, I knew something wasn't right. I just didn't know. But for the people that are concerned about the labels, I say that it's a shocker when you first get that. When you first get the news that, oh, I might be bipolar or I might be schizophrenic, because those are stigmatized labels, you know what I mean? Yeah. Label, you could be anything in this world, right? You could be a firefighter, a cop, you could be a hitman, you could be a gamer, but as soon as you get labeled as schizophrenic, it's like, oh my God, wait, you know what I mean? It's because mental health, that's just how we're stigmatized, I believe. I believe that people look at labels and mental health totally separate from anything else in the world. Yeah. And I used to be that person, like, I don't want to be labeled as this. I don't want to be labeled as that. But I'm like, listen, if I got general anxiety disorder, I need to know, you need to know so you can manage it. But I feel like mental health is always looked at as totally different from any labels. Like you have LGBT, that, not saying that's a bad label, not saying that because I'm proud. But what I'm saying is you have your titles there. You have title as nurse, you have title as therapist, you have title as Black. But when it comes to you got schizophrenia, you got schizoaffective disorder, it's like, you know what I mean? We're just looked at totally different.
And I 1000% agree with you. When folks struggle, I explain it in 3 parts. One, this helps insurance understand why you need treatment.
Right, that part.
No. 2, this helps kind of put in perspective what symptoms you're experiencing. And 3, this helps me help you. This helps almost translate what your physical, emotional, and psychological experience is into therapeutic terms for me. So you don't have to use it for anything if you don't want to.
Yes. And I have to,
if you don't want to use it, if you just walk out and say, I'm sad, okay, cool, you sad, but
true.
Like you said, it serves its purpose in clinical spaces. Whatever folks decide to do with it outside of that is your personal business. But we use it so we can be effective as providers and people understanding that it's okay. Schizophrenia is literally the label for a group of symptoms. And if you show up with these group of symptoms on this particular day, for whatever the reason is, that's what it's going to be determined as. Now, 2 weeks from now, 10 months from now, 2 years from now, you could show up to that same provider with a different set of symptoms and get a different diagnosis. And you know, I try to explain that is it is really a momentary experience. We do our best to assess you in this very small amount of time, assessment meaning we ask you these questions. We try to hit the high notes. Are you suicidal? Are you experiencing any anxiety symptoms, depression, increased sadness, anything around your appetite? You know, we just run down the list. We get to know some contextual factors, but then we make a decision from that information that we gather. And that's it.
And
And
that's it.
that's really for us, not necessarily for you. So I'm so glad that you explained it that way, because people struggle with it's like sometimes they can't get past the idea to get to the treatment. They're stuck.
There
the
you
idea.
go. That's exactly what you said, and that ties into like the medication management. If you are diagnosing them with bipolar disorder, you say, hey, we need you to get this medication, because it makes it real.
Yeah.
You know what I mean? It makes it real, even more real for that person, and it is a shock factor. But one thing I do like about like group therapies and things like that, they get to meet people who are not quite like them, but they are like them, and then they can see like, hey, you know, I'm dealing with this too, man. Like it's not as bad as you think it is. And it all ties into that label. Oh, I'm bipolar. Oh my gosh. Oh my goodness. I'm schizophrenic. But I tell people mental health is very, like you said, it goes from day to day. You might not be paranoid today. You may not be paranoid for another 10 years, and then something triggers you, and then you have a auditory hallucination or a paranoia out of nowhere. Yeah. So, and you're right, they are codes, but they're used to help you with the treatment options, to give for continuity of care, just in case they have to go from you to a doctor, to another provider, to inpatient. It gives continuity of care so everybody could be on the same page when it comes to your care.
And I love that you talked about continuity of care, because I want to get to that also. I wanted to add to what you were saying, because I love how you talked about just really people get into the bigger picture, and the idea is like, you don't have to agree. If you don't agree, go get a second opinion. You know, if you don't agree with me, and I'll say that quickly,
you have that right. Absolutely.
I'm not the sharpest tool in the toolbox. You know, if you believe that you can get a different perspective that will be more aligning with what you think is happening, I want you to do that, because this is about you. But I, you know, also want people to consider, like, the DSM is not like any other book, you know.
Oh no, it's not.
It's not. It's, you know, slavery at one time, like they considered slaves wanting to run away as a disorder. You know, it was. We have to consider that we are also in these spaces of being a provider and a person. And we understand as a person that being diagnosed has its limitations, it has its stigmas attached to it, but also as a provider, understanding that it also serves a relevant purpose in treatment continuity. Like we have to be able to serve you in this way. This is the way we can serve you anyway. So I love that you spoke to that, of like continuity of care and people being able to connect the dots, and it not being like, we're calling you this because XYZ. It's simply related to what you're showing us, what we hear, what we see, and that's it. Can you talk to about what that, like, if someone was saying, okay, Shatara, I don't know what's going on. You know, I'm seeing a therapist, but it doesn't feel like it's enough. How do they know that it would be appropriate to go get an assessment for inpatient treatment? What are the markers?
The markers are, again, very complex, but when you are going to pose a harm to yourself and to other people, absolutely the number one marker. If you're saying, hey, I'm feeling suicidal, I've been feeling suicidal all weekend, I had a plan, I thought about this plan, or homicidal, I thought about killing, I don't want to, but I thought about killing my whole ship or whatever.
Yeah.
And, you know, because that's real, those are real people feelings, I'm not making a joke. You know, I think when you're posing a harm to yourself and to others, you absolutely have to get mental health treatment. Sometimes you could go to the ED, and sometimes, you know, you might, and this is real, because we're going to talk real stuff. Even if, like, I know some people go through bad breakups, they don't know what to do, they're feeling, you know, oh my gosh, you know, I'm feeling kind of sick. You might go to the ED, and they may talk to you and say, hey, I think you're just going through a hard time, but I want you to follow up with a provider. You may not have to get inpatient care. Oh my goodness. Sorry about that. You see me? Sorry about that. You may not be able to get inpatient care all the time, but I always say the marker would be if you're going to be a harm to yourself or others. And that's multifaceted. So if you see, you know, if you see someone that might be schizophrenic, or having a schizophrenic episode or a manic episode, sometimes that doesn't always call for inpatient treatment, because a person interprets it as harmful because they don't know what to do. Also, we have to be careful, and I hate to say this, we have to, supporters of people with mental health, we got to be careful when calling the police.
Yeah.
When it comes to these things, and you have to let them know, like, hey, he's not harming it. If you're calling somebody that has like an issue and they need to be picked up, say, hey, my son is out, or my daughter, or whoever is outside, they're having a schizophrenia, they're safe, they have no weapons, I just need help to get them to the hospital.
Yeah.
You know, there's certain things that you have to say, but definitely if you're going to hurt yourself or others, for sure.
Oh, thank you for that. Well, and and like what you were saying, you know, there's always a non-emergent number to calling the police. Specifically, I don't know about Hampton, but I know in Virginia Beach, you can call the non-emergent number. They will have officers specifically trained and working with folks that are struggling with their mental illness at the time. They will have them come, and they treat them very different than if you were to come call 911,
Right.
the
That
emergency
part.
number. So
Thank
try
you for
to,
that.
try to allude to the non-emergent number. And the other part to this is, if you have someone who's struggling, the best thing I found, now, again, I know in my space as a therapist, it works a little bit different, but I believe in full transparency, and saying, look, this is where I'm at. You know, I think that we need some additional help here. I think that maybe going to get assessed at the hospital is appropriate. I don't believe that you're safe, but I don't want to scare you. I'm here to support you. I'm going to call the non-emergent number. I would like for you to make a decision. Would you like to go voluntarily? If not, I have to do my due diligence to call and get someone to take you. And it's not going to be your choice anymore. So you can either make the choice or someone will make it for you. But I want to be clear that this is what I am required to do. So at least it gives people space to say, yay, okay, I will willingly go. I may be unhappy about it, but I will willingly go. But like Shatara said, and you did a really great job about explaining this, if you are not safe, if you don't feel safe, if you cannot confirm that you're safe, if you want to hurt other people, if you want to hurt yourself, hands down, the number one marker. So let's say, and I'm glad that you also gave the example about, let's say they get there and they say you're not appropriate, maybe you need to see an outpatient provider. How do you recommend they move from there? How quickly should they be contacting someone?
So what I tell, what I have noticed that happens, people usually, you know, they come into the hospital, they may be saying, hey, you know, the psych resident come evaluate them and say, hey, we think you should follow your provider. A lot of times the people that sometimes, like I say a lot of times, sometimes people who are going through certain things already have a psychiatrist, and they get connected to them. But usually when they are getting connected with a psychiatrist, it will be within a few days. Now, that's not to say if you go home and you still don't feel safe, come back.
Yes.
Come back. We usually ask them to have a friend with them in the military. Sometimes you have suicide watches, things like that, just to make sure the person is safe. We do everything we can to, we try, we're not perfect. The military mental health system is broken, but we do our best to make sure we have the protocols in place for people to be safe as possible. Like you said, our goal is to make sure you're safe. And what I want people to understand is that we don't want to like call the cops or do this because we just think we know everything. It's really because and when you're in a mental health crisis, because it's a mental health crisis, we see things that you may not see.
Yeah.
And we hear things that you may not hear.
Yeah.
And we interpret it because you have to talk to a person with a sound mind who can interpret these feelings.
Yeah.
And if you're saying certain things, we're like, hold on, we want to make sure we can't watch you. So let's go to a place where somebody can watch you, make sure you're safe. And people think mental health wards are just like padded walls and padded walls, and we just inject medicine all the time.
Yeah.
And that is not true. It's straight jackets. No, these are things. This is why we have another session on impact, like what it really is like, but you have rights. So, but it's not like that. Some of these facilities are like regular hospital beds and things like that. So I think another thing, like, stigmas on TVs and stuff, how they interpret inpatient mental health wards and how they interpret how it looks and things, like how the people act, it is a stigma. So yeah, I just want people to know that it's about your safety. And even if somebody else, if you feel like, if your friend texts you and say, oh, I think I want to die or I want to kill myself, you got to do something about that.
Yeah.
Mm-hmm.
Yes, 1000%. Well, and that was actually my next question is, can you brief, because, I also get the questions of, well, Sade, if I'm only going to be there 3 to 5 days, what's the point? Can you kind of describe what the purpose of being inpatient is? Like, okay, they are assessed, they come inpatient, they stay 3 to 5 days. What is the purpose of being there?
The purpose of being in psychiatric mental health is, when you go when you have a crisis, you're not thinking straight, right? So you're in your phase, even if you're in a manic phase or if you are in a depressive phase, you are in a crisis, right? You got to be in a place where you can, one, decompress.
Yeah.
Decompress. You talk to the providers. A lot of times, like, people either need to sleep more.
Yeah.
Because, especially if you're in a manic phase, how when they come down, they be tired, they need some rest. A lot of times people need help too with that decision-making process. And sometimes, like, I can go to patients and be like, that was crazy, right? They be like, yeah, that wasn't a good idea. Yeah, we probably should have. What do you think we should do next time you're in this crisis? Is to make sure you're safe, help you with your decision-making process. And we are a bridge. We are bridging the gap between your therapist, your how you got here, the crisis that brought you here, into your continuity of care.
Yeah.
That's it. We want to make sure you're safe. We help you think some things through.
Yeah.
You'll go to group therapies, learn about different tools. We give you tools on CBT therapy. We give you tools on decision making. We give you tools on, you could talk to the chaplain. You have time to talk to your provider, giving you tools just to help you understand, take you from where you were and where you're going.
Yeah.
That's really what it is.
That was such a beautiful explanation. Such a beautiful explanation. Because I really don't think that people always understand what it means to be impatient, because again, they attach it to what you said earlier. Oh, you crazy. Oh, you done lost your mind. That's why you got to go to the hospital. It's not always about that, because you can be impatient for neglecting your self-care needs. You can be impatient for drug use. You can be impatient for any kind of substance use. You can be impatient for just not feeling like you are safe, like you can maintain your safety, like you said. And so it's not that you're crazy. It's really much less about the whole idea of being crazy, whatever that is, and more so about safety, just making sure that you're able to make reasonable decisions, and you're not going to make one that's going to affect your life permanently or someone else's. So I love the way that you described that, because it was such a clear, it gives people a clear idea of what that means. And like she also said, I mean, you inpatient to me looks like a sterile dorm room. It's not padded rooms, it's not people locking you up, it's not anything like that. It literally is a sterilized dorm room with things that they lock it down to, like the beds and things like that, so you cannot hurt yourself. So if you decide at some point, I'm having thoughts about, so if I'm having suicidal ideation, you can't take something off to hurt yourself or somebody else. But it is literally like a sterile dorm room with dressers.
And that's really for safety.
It is for
It's
1,000%.
safety. And outside of the military, now there are, and on the flip side, I see patients go to psychiatric wards and say, "Oh wow, nope, I think I think I could have just went to therapy."
Yeah.
There's really some people in here, and don't get me wrong, the reason why I think I love mental health so much because I find joy in it. I find laughter in it. It's not sad and depressing all the time. People that, manic phases, sometimes they say they rap to you, they say things, and it's so amazing to see how the human brain works.
Yeah.
And how and for me, if it wasn't for me like meeting these patients, I don't think I would have went back on medication.
Yeah.
So it's very therapeutic because sometimes you can humanize yourself. Well, you do humanize yourself to say, hey, how's that medication working for you? Oh, is it good? Oh, okay. Let me talk to my provider. Like, hey, maybe I was thinking about trying this medication because I see how it's helping this person because I have anxiety, especially when George Floyd and all that stuff came out. And we had a patient who was triggered by that, went into a manic phase for the first time. And we were talking. I was like, man, I have anxiety too from this. So let me go see what this provider is talking to. Let me go talk to my provider about it. And when I was 16, I went to a psychiatric ward for attempted suicide, and it was a sterilized dorm room. It was nothing like I thought it was. I thought, I was like, wow, I'm here. I went to group therapy. I laughed. I had a good time. It took me from the point of my crisis to my decision making process.
Yeah.
And that experience stuck with me forever.
I have like one or two more questions.
That's
And
okay.
it's something you said that I thought of and I wasn't actually gonna ask before, but
Mm-hmm.
because you always have people that say, no, I don't want to be in there. I don't want to be with people. It's people much sicker than me.
Mm-hmm.
That's not an appropriate space for me. Can you talk about um the levels or the different levels of sickness and how that's managed inpatient?
So for the military, we have two sides. We have a substance abuse side, and we have basically people that are dealing with a psychosis and substance abuse, and then we have like basically people that are dealing with depression, anxiety, and things like that. But if all these people had to mix for any reason, and because some state hospitals, they just
Yes.
they mix everybody,
Yes.
and people say, I don't want to go there, there's people sicker than me. But while that may be true in a sense,
Yeah.
um I tell people that this is your journey.
Yeah.
They may look sicker than you.
Yeah.
They may even act, because it's a stigma, they might be in a corner talking to. I'd rather for you to talk in a corner to whoever you're speaking with versus hurting yourself or anybody. The thing is that anybody could be in a mental health unit. It's just that some people in this world just don't realize what mental health issue they have. Everybody got some type of traumatic or mental health concern.
Yeah.
We're 1 foot in the door from a psych ward. That's
Sure.
every day.
For sure. For sure.
It's just that some people in the world, they use alcohol, they use drugs to cope, they use sex to cope, they overparent their kids to cope, they work successfully, they high function depression, high function anxiety. Everybody's 1 foot in the door, but you have to be grateful. I tell people, try to just look at it as your journey and your experience and take what you need from it.
Yeah.
Everything that we provide you may not be for you. But
Yeah.
be open-minded to say, hey, don't be so shut off in your treatment process that you won't have the opportunity to heal because you're so shut off about why you're here. Everything we have may not be for you. It's your job to take what you need, and there's something for everybody. We do group therapy. Some people been through them groups 6 or 7 times. They're like, well, I don't think I got nothing else. They be like, well, I done been through this about 6 or 7 times because I've been here 2 or 3 times. I don't think it's much more I get out. I said, you're probably right. But you're here, so you got something out of it. You're back. You know that you can come back. It's a seed that is planted in you. So if you are in a mental health crisis, you know where to go. It's a safe space. That's all I can really say. A lot. I know people think there's people crazier than them. Man, I say we all crazy. but these people know that they can come to this place and they know they're going to be protected. They know they have a shelter. I know in Florida, it was the opioid crisis. They wanted to, we had to make sure they were okay, but they were there. That's what mattered to us. Like, they were there and they were safe. And that's what you got to look at as well. It's no different.
It's not, I think that you said something, two things. One, thank you so much for sharing your struggle and your experience and your journey, especially as a kid, because it's a lot of kids out here struggling. Let's get to that. Like, it's a lot of Black and brown kids out here struggling, whether they're struggling alone, whether they're suffering silence, whether they're suffering with a room full of people. It's a lot of Black and brown kids out here struggling. And if they knew more about these opportunities, and that it wouldn't, and they wouldn't have to feel like, or be made to feel like they're crazy for engaging in the opportunity. Kind of like you said, I was able to go here and I was able to feel better, and I was able to, like, laugh and move past what I was struggling with. If they knew that, that it's okay, like, just hearing that. So I appreciate you sharing that. I really appreciate you sharing that. And also when you talked about the levels, and then people just focusing on their journey, that's 1000%. Because let's be clear, we can go into the mall, we can go into Taco Bell, we can go into Kroger, and these same people are in a non-controlled space. So it's really not different. And it is actually more dangerous in the world than not. If I have to be, clearer, you have people who said, okay, I'm not okay. Or someone else said, you're not okay. You need to go here and be assessed. Cool. You're in treatment. And they're in a place where they're going to be safe and you're going to be safe. Versus being out in the world, and you could walk across any of these people at any time, just like they could walk across you. And there's nothing between you and I, nothing. There's no doors, there's no staff, there's nothing. I'm not medicated, and there's nothing. So I love that you said that, and just like people focusing on their journey and what they're there for.
You got to focus on you, because I think it's a personal responsibility to be mentally well. And mental health wellness looks different for everybody. Sometimes it's just waking up in the morning, be able to put on clothes. There's programs where we have to teach people how to iron their clothes because they're so mentally, depressed or anything. There's programs that teach you how to iron your clothes, how to get back in the game. It's your responsibility to get to a place, because everybody, I don't hear anybody say, everybody has a purpose in this world.
Yeah.
And even in the midst of your crisis, it's still part of your purpose. You know what I mean? It's still part of where you got to go. This being in a mental health crisis is nothing to be embarrassed about. Like I said, everybody has been there. We all just handle it differently, whether in a good destructive way. Some people use their faith. Some people go to mental health hospitals. It's just that it's nothing to be embarrassed about. And I think these conversations and speaking about them are very important, because we have to let people know that, like, bruh, it's okay to go. It's okay to take medication. It's okay. Every time you go to a psych ward, you may not even be there, as long as you think you could be in there 24-hour hold. There obviously you've got the Baker Act and things like that. Those are different, court order type things. And sometimes it does get extreme like that. But at the end of the day, you just want to make sure that you're safe, and that the person that they're safe, and the people around them are going to be safe as well. It's all at the topic of this conversation is safety, and making sure they are getting to a mentally well place where they can have good decision-making skills.
I love that. Thank you so much. You have so many jewels today. Where can people find you? Where can they also find information about your nonprofit if they're interested in joining? Or
sorry, this is like our emotional support dog. That's Bella. So we got one of those too. I think she gives me hugs. Okay, so if you want to reach me, I have a website, www.wocmha.org. or Facebook, www.facebook.com/WOCMHA. And you guys can join our support group. We'll love you. We'll love when you talk to you, give you some advice, drop some jewels. You're in there too. We be talking. And we trying to reach more women. I'm getting back in the game with that. And I'm definitely grateful that you had me on this platform.
I'm glad that you are so open to sharing all of your knowledge. And I am absolutely a part of the group. I've invited women to the group. Like, I think that you do such a great job about encouraging and empowering and just making struggle and stress and strife is normalized and people feeling safe.
Yeah, we have safe spaces, especially I tell my belief is that Black women can heal Black women.
Yeah,
I absolutely am a firm believer in that. I know we're stigmatized that we can't work with each other, we can't do each other, but I swear, I just, it's something about that connection because we understand each other. And that's why I want the space is for people just to come and they don't have to be judged. They don't have to get talked to down to. It's like, man, let me love on you.
Yeah.
Let me tell you, well, I'm going through the same thing. You know, how are we going, I'm praying, I'm gonna pray for you. I give you some virtual hugs. I'm going through the same thing, but you know, I'm going to be there for you. And that's important. That's important. Like, I'm never going to be too busy for you. And I hope you would never be too busy for me. And that's just how I feel.
I love that. Well, I thank you so much, Shatara. And y'all, please follow her. Get into the group. It is a fantastic group. Or even if you don't, if you know a friend, it is a great support space to engage in. And if you have any questions, you can always email, join the groups, ask questions. And until next time, we're so glad that you joined us for a good time. Have a good day.
Thank you. Thank you. Bye.
Bye.
Bye.